What is audiometry, and what do decibels mean? Imagine being able to find out exactly how well you hear at different pitches and volumes. That's what audiometry does. It's a scientific way to measure hearing ability through a series of simple, safe tests. During an audiometry test, a healthcare professional uses a device called an audiometer. This instrument plays sounds at different pitches and loudness levels through headphones or bone conduction devices. The goal is to see how sensitive your hearing is across a range of sounds. The tests include pure tones, which are sounds at specific frequencies, and speech sounds to check how well you understand spoken words. The results are recorded on a graph called an audiogram, which shows your hearing thresholds at various frequencies. This helps doctors identify if you have hearing loss, what type it might be, and how severe it is. There are also other tests related to audiometry, like impedance audiometry, which checks how well your middle ear is functioning, and auditory brainstem response testing, which measures how signals travel from your ear to your brain. These tests give a full picture of your hearing health. Now, let's talk about decibels. Decibels are the units used to measure how loud a sound is. Think of decibels as a way to compare the strength of sounds. The human ear can detect sounds from very quiet, like a whisper at around 20 decibels, to extremely loud noises like a jet engine, which can reach 140 to 180 decibels. When audiologists perform hearing tests, they determine the quietest sounds you can hear at different pitches, measured in decibels. This helps identify if your hearing is normal or if there is some degree of hearing loss. The pitch of a sound, measured in hertz, tells us how high or low a sound is. Human hearing ranges from about 20 hertz, which is a deep bass, up to 20,000 hertz, which is very high treble. Most speech sounds fall between 500 and 3,000 hertz. Hearing tests are essential because they help detect hearing issues early, especially in children, to prevent speech and language delays. For adults, they help maintain safety and quality of life by identifying hearing loss so that appropriate management can be provided. If you have concerns about your hearing, it's always best to consult a healthcare professional who can perform proper testing and give personalized advice based on your unique needs.